Hi friends, this is Dr. Magarana from Magasam. Welcome to my YouTube channel. Today's our topic is diabetes mellitus. To understand the diabetes mellitus disease, first of all we have to know the anatomy and physiology of the pancreas. So let's get started. Anatomy and physiology of pancreas. Pancreas has two main parts, exocrine part and endocrine part. Exocrine part and endocrine part. Exocrine part secrete the pancreatic enzymes. Pancreatic enzymes. This helps in these pancreatic enzymes helps in the food digestion. Food digestion. Endocrine part. Endocrine part has four major cells. Four major cells and two minor cells. Two minor cells. Four major cells are alpha cells, beta cells, delta cells, and pancreatic polypeptide cells. Alpha cells secrete glucagon. Beta cells secrete insulin. Delta cells secrete somatostatin, and pancreatic polypeptide cells secrete pancreatic polypeptide hormone. These four major cells secrete the four hormones. How to remember these four hormones? By a mnemonic. AG beats for puppy. This is the mnemonic. AG beats for puppy. This is the mnemonic to remember the four major cells and their hormones. There is a couple. In that couple, wife said to his husband that bring some beads for the puppy. Puppy is the name of the dog. AG beads for puppy. A stands for alpha cell, secrete glucagon. B stands for beta cell, secrete insulin. D stands for delta cell, secrete somatostatin hormone. And P stands for pancreatic polypeptide cells, secrete pancreatic polypeptide hormone. This is how you can remember the cells and their hormone secretion. Again recall, AG beats for puppy. It is the mnemonic for remembering the hormones secreted by the major cells, four major cells. A stands for alpha cell, which secrete glucagon. B stands for beta cell, which secrete insulin. D stands for delta cell, which secrete somatostatin hormone. P stands for pancreatic polypeptide cells, which secrete pancreatic polypeptide hormone. Two minor cells that we have D1 cells which secrete VIP, that is vasoactive intestinal polypeptide, and enterochromatin cell which secrete the serotonin hormone. This is all about the anatomy and physiology of the pancreas. So let's look at the definition of diabetes mellitus. Diabetes mellitus definition. Diabetes mellitus, it is the metabolic disorder having tendency to hyperglycemia, It is the definition of diabetes mellitus. You can simply remember metabolic disorder with hyperglycemia. Hyperglycemia means increased glucose level in the blood. Increased glucose level in the blood. Whenever the word suffix EMI comes, it related to bloods. For example, hypoalbuminemia, that means less albumin in the blood. Hypo means less amount of albumin in the blood. EMI means means related to blood. Or other example is hyperlipidemia. Emia means hyper means excess amount of lipid in the blood called hyperlipidemia. Or hypoproteinemia. Emia means related to blood. Hypo means less protein in blood. This is how hyperglycemia we can remember. This is the definition of diabetes mellitus.